Our topic of discussion today is epistaxis. Epistaxis means bleeding from nose. So let us know about some relevant anatomy. Little's area or Kisselbeck's plexus. As I have described in the previous slide in details about the Little's area, so now I will just brief you. It is located in the anterior-inferior part of the nasal septum just above the nasal vestibule. It is supplied by branches of both external carotid artery and internal carotid artery. It is the most common site of nasal bleed in children and young adults. Why? Because this area is prone to drying effect of inspiratory air current and it can be easily traumatized because of frequent nasal picking. Second common site is retrocolumnar vein. It lies, retro means behind and columella. So it lies behind the columella and runs vertically downwards, crosses the floor of the nose and joins the venous plexus on the lateral wall of the nose. It is a common site of venous bleeding in young people. Woodruff's plexus. It is a common site for posterior epistaxis in adults. It is seen along the posterior end of the inferior turbinate. Previously, it was thought to be an arterial plexus of the anastomosis between the sphenopalatine artery and posterior pharyngeal artery, but nowadays it has been suggested to be a venous plexus. What is the etiology of epistaxis? It can be divided into local and general causes. Let us discuss about the local causes first. Congenital. Hereditary hemorrhagic telangiectasia, also known as Osler-Weber-Rendu syndrome. It is an autosomal dominant type and it leads to recurrent epistaxis. The second one is traumatic cause. The most common one is nasal picking seen in children. It is the most common cause of epistaxis in children. The second traumatic is any fracture. Then foreign body. You should remember, if a child has presented you with unilateral epistaxis or unilateral nasal discharge, then do suspect foreign body. The fourth one is iatrogenic. Fifth one is blowing of the nose too hard or violent sneezing. Third one is infective and inflammatory causes as I have described here. Neoplastic, it can be divided into benign and malignant. So these are the causes. Environmental can be due to high altitude exposures, Cazen's disease, chemicals and pollution. Miscellaneous, it can be due to deviated nasal septum and nasal spur. Why? Because deviated part of the nasal septum is exposed to drying effect of air and crusting, and also rhinitis sicca. Moving on to the general causes, first one is cardiovascular system. Hypertension is the most common cause of epistaxis in adults or elderly. The other causes are mitral stenosis, congestive cardiac failure, tumors, that is mediastinal tumors due to raised venous pressure. Hematopoietic causes, all are described. Nutritional causes. The other causes are in the blood vessel, liver disease and kidney disease. I have described why so. The other causes are drugs like aspirin and NSAIDs and hormonal, leading to vicarious menstruation. So some high yield points are topical nasal antihistaminics and corticosteroids can lead to drying of the nasal mucosa, leading to irritation and hence epistaxis. Recurrent epistaxis, if seen in a young male, is due to juvenile nasopharyngeal angiofibroma. If seen in a young female, could be due to hereditary telangiectasia. Here you can get a history of bleeding from multiple sites. What is the treatment? You can treat it with laser, argon, KTP or Nd:YAG, or septodermoplasty. Septodermoplasty, it means the nasal mucosa over the Little's area is replaced by split skin graft. So this is in brief how we evaluate a case. Next I'll move on to management. Now in management you have investigations and treatment. Follow this treatment protocol.